Hello everyone, here I'm back with the video lecture and today we are going to discuss the key scenarios related to the frozen shoulder. Before starting with the key scenarios, we can just take a brief look on the frozen shoulder itself. Frozen shoulder is a progressive or a chronic inflammation that is present in the on the shoulder joint and glenohumeral joint. Progressive pain and stiffness in the shoulder joint basically results in active and passive range of motion limitation because it is affecting the glenohumeral joint. It is called as frozen shoulder, as you know. But the other name, that is adhesive capsulitis, why this name is basically the adhesive capsulitis when this can limits the active and passive range of motion. It was because where the capsules are present or the capsule is covering the shoulder joint, at that spot the capsules get thickened and contract, forming the adhesions that basically at the end results in restricting the range of motion, whether that is active range of motion or passive range of motion. So this was the major terminologies that we can use for the frozen shoulder. The other one was the adhesive capsulitis. Majorly, there was no exact cause of frozen shoulder, but there are some factors like diabetes mellitus, the thyroid dysfunctioning, the post-surgery or post-injury surgery, post-injury shoulder. With that, you know that age and gender itself, the Parkinson's disease, the cardiovascular disease. There are many other things. Okay, so we can just discuss some of them, and after later on we can just start with the phases or the stages of the formation. So diabetes, as you know, that patient with diabetes have on a higher risk of frozen shoulder, possibly due to change in collagen metabolism or body healing processes. Other than that, you know that if you can immobilize the shoulder joint for a long period after surgery or injury, it can at the end lead to the development of frozen shoulder. Age and gender above 40 to 60 is basically the age where you can affect that. And females are more prone, as you know that higher incidence are present in females. So age and gender majorly affecting the women's above 40, but it also affects the men, but not the same way as women. So what was the stages and phases? There are three stages or phases, as you can see in the screen: the freezing, frozen, and thawing. Freezing, basically the painful phase, basically happens from 2 to 9 months. Shoulder pain is gradually onset, increasing the stiffness. Range of motion, now the range of motion is going to decrease, okay? And here you can feel the capsular pattern, or you can just you can talk about the capsular pattern. Capsular pattern of frozen shoulder is very important as a physical therapist because you have to train the shoulder, you have to work on that specific movements to get rid, or you can just say that to uh, basically improve the patient's range of motion. So, starting from the external rotation, then after some time the abduction is adding, and with that, after some time, it's internal rotation. So this is majorly the capsular pattern. The first range that is basically affecting in the patient's normal structured joint is basically external rotation. After that, after external rotation is basically abduction, and after abduction, basically internal rotation. Okay, remember that. That is very important to remember. Second stage is basically the frozen stage or the adhesive stage. It basically happening in between 4 to 12 months. Pain may reduce, where stiffness limits the daily activities majorly, because you know that this is the phase where you can patient can feel the frozening of shoulder. the stiffness persists. The stiffness can make the shoulder difficult to move. So this is that stage. Range of motion is severely limited in this stage. Thawing is basically the recovery stage, okay? It is happening from 6 months to 2 years. Gradual return of mobility, pain continues to decrease, the functional activities are getting improved. These are majorly the recovery may be slow, but it can basically come back after the years, okay? So your patient can experience some kind of improvement as well later on. But in starting, their severity of pain is very high. Okay. So majorly, as you know, you can diagnose with the normal tests like apply scratch test, opposite shoulder test, cross body test. There are many other one that some uses the scarf test, and other than that, there are many others. So you can diagnose after diagnosing that some kind of imaging if required for checking the osteopenia or capsular thickening for MRI. You can go for MRI and ultrasound as well. But majorly it can diagnose with active and passive range of motion and specific special tests that we have discussed, the scratch test, cross body stretch, basically the scarf test. These are majorly the tests that you can just use to diagnose the patient. So, because you have to differential diagnose the patient, you need to rule out other causes like rotator cuff tears, arthritis, impingement as well. So, you need to take care of the history and physical examination as well. So, the major goal of today's lecture is basically the case scenarios. Before starting case scenarios, I'm just going to give you a brief introduction on the stretching maneuvers, okay? Remember, today's lecture is majorly focused on stretching techniques. So the cases that are related to frozen shoulder is majorly focused on frozen shoulder stretching techniques, not the complete treatment, because I am going to discuss 5 lectures and you cannot cover, sorry, 5 case scenarios, and I cannot cover the complete, but majorly focus on stretching techniques. So what was, as you know, that the pendulum stretch, what was happening? Patient can lean forward, not like that. This is just the random picture. Patient can lean forward as you know that the forward bending of the patient, arms are dangling. Yes, arms are like dangle like that. You can make a small circles using the gravity for 13 seconds on the both ways, like first on the clockwise, then after that you can go for the anti-clockwise. Towel stretch for the internal rotation is very important. You know that as you know that if the patient wants to come their hair, or you can just say that if you want to close the zip, as you know that they have written here that if you want to close the zip of your backpack, you know that you can move the arm out from the back, or you can just take the towel on the both hands and just both hands needs to be on the back side of your, or on the back side of you, and now you can hold that 15 to 30 seconds or 5 to 10 repetition at the same time. I'm going to give you the view of these pictures later on, but these were the major stretches that we are going to discuss in this lecture. Wall climbing, as you know that the finger walk fingers up the wall in flexion, stop at the mild resistance the patient can feel, and maintain position at top for 10 seconds and hold that. Modification, as you know, if you want that, use a small shorter range sport with opposite hand. Start with table slides, as it is basically depending on your patient, okay? Modification is always depending on your patient, so you can just modify. These are the standard, okay? You can modify any of the movement related to that, related to your patient, related to your patient's tolerance, uh, basically your patient's comfort, okay? After that, cross body or you know that the cane armpit stretch basically. Cross body is basically targets the posterior capsule with 15 to 30 seconds the static hold. I am going to give you some views of these pictures so you can just understand what was that. Stick or plain armpit basically stretch was you can just use a cane or the lift arm from below while seated to on the top of on the back. It is basically used with the pulley system later on, but with starting you can just use with starting with some sticks so that patient can feel comfortable before going towards the pulley system. But this was not only the treatment method that is using on the frozen shoulder patients, but because I am focusing on stretching techniques today, so I am going to give you guide on the stretches for the frozen shoulder. Okay, so the first case scenario we have here is basically the early frozen phase post surgery. Remember, okay, the stage of the frozen shoulder, right? The second stage of the frozen shoulder. People used to think that these are some kind of like uh, easy views, or you can just say that these are not important as a physical therapist to understand these detail videos, or you can just say that the details of case scenarios. I have seen patients that they can just diagnose randomly the I've seen the doctors that can just randomly diagnose every patient with a frozen shoulder, but you don't have to do that. You know that. Frozen shoulder is something else, okay? Early frozen phase, that means stage 2 after the post surgical. 47-year-old female, 6 week post surgery shoulder surgery with pain and stiffness. Now, because they didn't mention here what kind of surgery, so you don't have to go in depth, or you can just ask a patient if you need to. But for as a doctor, as a physical therapist, I am surely recommend you to ask a patient what kind of surgery that patient had before 6 weeks. Okay. Now the treatment focus here is pain education and gentle mobility exercises. So pain education is basically related to how you can basically educate the patient related to what the treatment plan, okay, the prescribed treatment. So before starting any of the treatment you need to ask a patient many questions, okay. What kind of pain she can feel, the basically you can uh, give the random number, you can just ask the 0 to 10 reading skills, you know that the numeric pain rating scale, you can just ask patient that they can rate their pain, and after that you can just ask about the stiffness as well, and then you can just give the patient some kind of education that what she have to do other than what other than the stretching as well, like what kind of position she had to adapt to start any of the stretches, and her daily activities, what kind of movement she need to perform on the daily basis, okay. So pendulum stretch is basically for the early frozen phase after the post surgery is the most recommended, okay, because this is the light exercise without the you can just say that without any too much, or a patient cannot feel too much of the stress on their joints. So this is the easy stretch patient can perform after the surgery. Other than that, you can prescribe the finger walk with limited motion. Majorly, why I can discuss the stretches in this lecture, because stretching is very important in the frozen shoulder, and many I have seen many doctors they can recommend other exercises, but they cannot recommend the stretches to the patient. That basically affects the recovery stage, or you can also say that the prognosis of the patient as well. So pendulum stretch, as we have discussed before, finger walk with limited motion, you can just go for that. These are the gentle mobility exercises. With that, you can just add other exercises like some patient require the cog wheel rigidity exercises, and some patient requires the normal range of motion exercises, the complete circumduction, or other than that, you can see that what kind of ranges are affected in this patient, and you can just go for that. Okay, this is the first case scenario. Okay, the second one was the frozen phase in diabetic patient. Okay, this is interesting. A 58-year-old male with type 2 diabetes, a severe stiffness, and the minimal pain. So that means this is the patient of diabetes in the stage 2 of frozen shoulder. So because the stiffness is getting so severe, you can still ask the patient if there is pain, and ask the patient the severity of the pain at the same time. So majorly the treatment focus is on the capsular stretching and maintaining the range of motion for like you know that capsular stretching means the internal rotation, external rotation, abduction. So majorly prescribed stretches are the tall stretch that is majorly focused on internal rotation, cross body arm stretch, and with that stick stretch for abduction. Stick or you can use anything like that. So this one was the third case. Okay, major focus on this. And after that, at the end of the lecture, we are going to discuss these stretches on a picture view in the images. Third one is basically the case of the thawing phase, the stage 3. The office worker, a 42-year-old female, sedentary job, gradual improvement in shoulder stiffness because she can feel that improvement after that long period of time. So she can just ask for the some functional limitations. So we can majorly treatment focus on the functional strengthening for full range of motion, because of this, or you can say that because of the frozen shoulder, her work condition is getting affected, her ergonomics are getting affected, her normal working as a office worker is getting affected. So you need to focus on the strengthening plus stretching at the same time. So prescribed stretches is basically wall climbing, the cane stretch, and the cross body stretch. These are just the stretches. Okay, remember I didn't complete the treatment plan in these case scenarios. I'm just majorly focused on stretches so you can understand which kind of patient requires which kind of stretches. Okay, so the major focus of today's lecture is remember that the stretching techniques. Okay, this is basically the third, the thawing stage, where that is the recovery stage as well of the frozen shoulder. This first case scenario is hormonal contributed in postmenopausal woman. A 55-year-old with hypothyroidism, 4 month shoulder immobility history. Remember that she is of hypothyroidism. So that means there are some kind of thyroid dysfunctioning is present here, right? So major focus is patient education. You need to basically educate a patient related to hypothyroidism as well, and the shoulder immobility and the delay in their treatment plan as well. Daily consistency is very important for her to perform the home stretching program. Majorly, the stretches prescribed because 55-year-old is still are not very, like you can say that she is very good in mobility, but not only on shoulder because shoulder is getting affected because of the frozen shoulder. So you need to prescribe this some kind of stretches like pendulum stretch, towel stretch, finger walk, cross body stretch. These are the kind of stretches you need to prescribe to the patient in these cases. Okay, the case scenario number 5 is basically the male gym enthusiast with sudden range of motion loss. Basically, a 35-year-old gym goer with a mild strain and reduced the external rotation. So basically, it is the mild stage, like freezing stage, because patient can just reduce its external rotation in this case, and with that he can just feel the mild strain as well. So majorly the treatment focus is to restore the function safely with targeted stretching exercises. So majorly what kind of stretches you can go for? Cross body, towel stretches and cane stretches, because you need to take care of patients restoring the function safely. You need to take care of the precautions as well, because this is the early stage, or you can say that the starting of the frozen shoulder. So you need to take care of the patient's arms, and it's basically the simple way of saying that patient's shoulder and shoulder capsule, you need to work on that in a precautionary manner, so you cannot damage, or you can just not further damage the patient's focus area or the external rotation as well, because patient is already feeling the mild strain on that area. So because I am just discussing these case scenarios in a very brief way, we can just discuss these stretches in this lecture at the end, as we have discussed before. So starting from the first, that is basically the pendulum. These are basically the all the stretching maneuvers that we have discussed in this lecture. The pendulum stretch, as you can see, one hand on the chair and the other hand of the patient is making the small circles to complete this motion. That is basically performing at the beginning of any of the prescribed frozen shoulder treatment. Okay, so you can prescribe this as an early treatment plan. Second one was a towel stretch, is basically for internal rotation, majorly targeting the internal rotation. So one hand is holding the one end of the towel, the second one was holding the other end, and both hands are basically making the downward and upward motion. One hand basically move the downward, and after that, you can just perform with the other hand the upward motion. This is basically the finger walk. You can just walk on the wall and basically moving upwards in the direction, and then after that, you can just come back downward. Third one was the cross body arm stretch. Basically, you can just cross the arm on the other shoulder side, and you can just stretch that. And basically, after that, you can just discuss the shoulder range of motion with cane. As you know, you have seen both hands holding the cane, one hand on one side, other hand on the other. And you can just perform the abduction movement like this, the upward, and that then coming back to the downward movement. Okay, so this is basically the mm, for the abduction, as majorly targeting the abduction of your shoulder joint. So this is all for today. So thanks for watching. If you have any query, you can ask, and bye bye.